Hi, my name is Dr. Arnold, and it is now 11 months since I opened a dental practice in Kirkham in Lancashire. In this video, I just want to go through some of the highlights, some of the things that have happened on this journey to get to where we are. We are now 11 months old. We opened up our doors in September 2024 in Kirkham, which is part of the Fylde Coast in the northwest of England. Since then, we've been growing as a practice. We've been growing in terms of numbers, in terms of members of staff, and we've been growing in terms of the number of patients becoming members with us. So just take it back a little. I qualified as a dentist in the University of Central Lancashire, which is in Preston. So it was a 4-year degree. I'd done a science degree for 3 years in Leicester, and then I spent 4 years doing a dental degree in UCLan in Preston. Qualified in 2017, and I spent a year of foundation training in a market town called Chorley. So this is between Preston and Manchester. So a small place called Chorley, and I worked there as a foundation dentist for a year. Really great time there, and one of the pivotal moments was the fact that I was introduced to this system of Invisalign, which uses clear plastic trays to straighten teeth. So that's important because before then I only knew that dentists could straighten teeth using the traditional metal braces. So that was pivotal for me because it opened up my mind to a different method of treatment, type of brace that I could use for my patients. So during my foundation year, I also picked that up as a skill and became a provider for clear aligners, those plastic trays to move and straighten teeth. After my time as a foundation dentist, I then worked as an associate dentist. So I went from being employed in that year to self-employed, worked at a range of different practices, and my experience was building. I was finding that I enjoyed my interactions with patients, and I enjoyed getting to carry out orthodontic treatments using clear aligners. So I took my training further. I completed a 2.5-year course in fixed braces. So I learned how to use fixed braces, but that really gave me a foundation for understanding how to move teeth and the biomechanics behind moving teeth. I completed a diploma in clear aligners, and that was more specifically for using plastic to move teeth. So I completed a diploma in that, and I've done other courses to supplement my ongoing development as a dentist who straightens teeth. It then became apparent to me that, my ambition, in applying to dentistry was to be within healthcare and to also own a business. And as I was getting more experience as a clinician, it got to a point where I felt like I had the skill set to provide good quality dentistry for my patients. I had the confidence to do that. I also found that I was getting involved in training up team members to do certain tasks, delegating, and really being able to handle the wider team within a dental practice setting as an associate. And that gave me the confidence to say, you know what, I'm ready to open my own dental practice. So started saving for the build of my own dental practice, and that culminated in 2024 in September, me opening the doors to my dental practice, Lancashire Smiles Dental Practice. It was a roller coaster ride getting to that point, working with builders, working with suppliers, working with different teams to bring the vision to life. It is the hardest thing I've ever done. And at the same time, it was the same year that my second daughter was born. So a lot was going on, but we got there, we made it, managed to recruit some team members, and we had our CQC date on the 2nd of September. Remember it to this day. And Care Quality Commission, the CQC, are the ones that give you the permission and approval to start seeing patients as a dental practice. So that was on the 2nd of September. And by the end of that week, I had got the green light from the CQC to say that we were safe to start seeing and treating patients. So our first ever patients were seen on the 9th. Monday the 9th of September, if I remember correctly. And from then on, we've just been growing as a practice. When we first opened, we were a smaller team. We had a practice manager. The practice manager also doubled as a qualified dental nurse. We had 2 trainee nurses. So these are students who had finished college and this was now their first full-time job, and they were on an apprenticeship. So we had 2 trainees, and we had a front of house join us as well. The front of house having reception duties, making phone calls, booking patients in, and then it was myself. So it was a very small team. So myself, the 2 trainees, the practice manager, and the front of house. There was five of us at the very beginning, and things were working great. We had over 100 people sign up to our membership plan, so they became our first group of loyal patients who said, you know what, we want to make this our own practice. So they joined our membership plan, which just basically means that they pay a monthly fee, and it ensures that they're seen regularly for their hygiene sessions and their checkups. So that was an overwhelming response to have that many people signing up within the first month saying that they want to be patients of our practice. And since then we've had a lot more people join practice. So it was an explosive month in September, October, November. The team continued to grow. We actually had a dental therapist who popped ahead during our opening week in September. She gave in a CV, and she actually became our first dental therapist to join the team. I think it was in October. So she popped ahead in September during one of our staff meetings, and by October, I believe, she joined us as our first dental therapist at the practice. Things continued to grow, and things were growing so well that we decided to open a second treatment room. So we started with just 1 treatment room that was kitted out, but we have the capacity to have 3 treatment rooms going. So we opened up the second treatment room. We invested, refurbed it, got a new dental chair for it, cabinets, the whole works, so that we could have 2 treatment rooms going to have the capacity to handle more patients. By the December, we were thinking, it would be good to increase the team even more. So we started having interviews for a head nurse role, and we recruited a head nurse who then joined us by about March time. She needed to work off, I think it was a 3-month period that she had to give notice to a previous employer. So interviews were done by end of December, and by March we had the new therapist and we had a head nurse. A second therapist also joined us. So we had 2 therapists, and we had an associate dentist join us as well to handle general dentistry. And we got to the point where we could now actually have more services open up by getting an implant dentist to support us with our treatments, to provide implants. So these are the gold standard for replacing missing teeth. And we also got a cosmetic dentist who can do some bigger cases, wear cases, tricky root canals. We got a visiting dentist just to help us with that. So we've been growing as a team, as a practice, and just developing our systems, the way that we interact with our patients on social media, with emails, even letters. So it's been, a whirlwind of activity. Especially as a new practice owner, it's been an exciting time, hardest thing I've done, but I would say that I would have regretted not taking this step in owning a dental practice. Couldn't have done it without a supportive family, especially my wife, who was really crucial in helping me throughout this whole process, and helping me with just making sure that things were good with our family, with the 2 young girls that we have as well. So just to round this off, I know that some dentists who are thinking of owning a practice one day may be watching this. Just 3 things that I would say to make sure you've thought seriously about. The first thing is, if you're going ahead with starting a dental practice, especially a squat practice, so from the ground up, a practice with no patients to start with, I would say learn how to develop a waiting list, because that waiting list will be your first group of patients that you'll be seeing from day one. So I had a waiting list, and I promoted that waiting list so that people could express their interest in joining us as a practice. So waiting list was crucial for the explosive start that we had in our first month. A second thing I would add to that would be the fact that I've made a decision to be a practice that is mainly a membership, which means that people join us on the membership plan. And that's really good for making sure that you've got a consistent income for the practice, which is key in the early days, something you can depend on. And it also allows patients to make that commitment to say, we're going to be loyal to this practice and come to this practice for our regular care and treatments. Third thing I would say, if you're going to be in a similar position like me, where you're self-funding this and maybe getting a loan, I would say think about, the first year. That first year, your income that you generate from treatments you carry out during the year, it's likely that that income is going to be needed by the business to pay wages, expenses, loan repayments. So I haven't, 11 months in, got to a point where I'm taking my dentist wage from the business. So what I would say is have a reserve of funds available to live off of, or if you've got a partner that's working, that can help to cover, your living expenses. I would just say have a plan where you're not needing to take an income from the business during that first year, because the business will need a lot of investment and it will need a lot of ongoing funds to keep it going. It's a newborn baby, this business, and it's going to be draining a lot of resources and finance at the very beginning. So for at least 1 year, have a plan to be able to live without extracting any funds from the business itself. I hope that has been helpful. I just felt that it was a long time since I'd given or shared any content, from myself. When I first started this YouTube channel, it was back in 2020 during the pandemic, and it was to help aspiring dentists with their applications to dental school. And then, since then it's evolved as I've got to experience more within dentistry. I'm at a point now where I'm mentoring other dentists who are interested in using clear aligners to straighten teeth. So that's something that I do now. I mentor the dentists in that. And now that the business is doing a lot better and it's able to sustain itself a bit more, I'm getting more time to be able to now do videos like this. So I hope to post some more regular videos, and let me know in the comments if there are any points that you want me to cover in future videos. As you'll have seen, a lot more of the video clips and visuals from the practice have been coming out and will come out as YouTube shorts or reels, so keep an eye out for that. But yeah, thank you for your time, and I hope to see you at the next video.